I often wonder who I really am: a doctor, an engineer, an architect, a finance expert, or a business strategist. I wore many hats during my last 20 years. Simply speaking, I am a doctor turned hospital planning, design, and management consultant. I completed my schooling from Indore, the cleanest city of India. The worst part of the education system those days, you people must be aware, to choose your career path after grade 8, where you really don't know what exactly you can do. There are only three streams available: science, commerce, and arts. While I was doing my MBBS, the major problem I faced is from a government medical school, government school, and a Hindi speaking person. So, first problem was English. Though I finished my education from school, then medical college, and I was planning to pursue my career in surgery. I got admission through merit for general surgery in Indore Medical College. While I was pursuing general surgery, the central government decided to start central pre PG, and 25% of the seats went to All India quota. By mistake of my medical college administration, my seat got unregistered and went to All India quota. Suddenly, I was left without PG. One fine night, I decided to not to go to US and pursue my career in hospital planning, design, and management to improve quality of healthcare in India. In those days, for doctors, it was a dream world of US where they could get any and everything on this earth. But I stayed back, and since then, I am working towards improving quality of healthcare. While doing this diploma, I did my thesis for developing detailed project report for a 100-bed hospital in Mumbai. Detailed project report basically is market research with development of financial feasibility report. Till then, I never touched computer. I never learned maths or commerce. But still, I was forced, and with lots of help, I learned computer as well as Excel software in computer to do my feasibility report. It gave me lots of confidence, and till now I have done more than 100 financial feasibility reports for various major prestigious hospital projects in India, like for Asian Heart Hospital or Umrao Wockhardt Hospital. Even developed PPP, public-private partnership models, for Mumbai Port Trust, and first such model was created for GT Hospital Mumbai. Unfortunately, it never took off. This again improved my confidence to do things further. I started learning management skills. While learning management skills, I was in Malabar Institute of Medical Sciences, Calicut. There, though I went for management and implementation of strategies, but one of the director asked me if I could look into their hospital plans. The hospital was designed by one of the most famous architect of South India who had done hospitals earlier. Director that somehow plans are not good. He asked me if I can suggest certain things. I said, this is not my domain. But then they requested me to sit with the architect and revise the plans. To our surprise, the revised plan came out very well, and even promoters decided to break almost 1 lakh square feet of internal walls of the hospital and redo them. This prompted me to learn architecture. So, over a period of time, then I started learning AutoCAD, which is a software to design architecture and make architectural designs. Even I got an opportunity to design first model mother and child hospital of Government of India. That design became a landmark by Government of India, and Government of India started mother and child hospitals in almost every district of India based on the same design. The path was further little different. I was invited by National Health Systems Resource Center in Delhi to be part of the expert team to design district hospitals, sub-district hospital and rural hospital designs for Government of India, Premier Institute of Medical Sciences. The organization got lots of accolades from across the globe, and for the same, I was awarded at House of Lords, London, by Lord Navneet Dholakia, and later on, I was felicitated by Mr. Burman, who is Chairman Emeritus of Daba Group at London. The financial part of it, the architecture part of it, and various other management projects, they pushed market to accept me as a hospital expert. Now I was designing a roadmap for SMS Hospital Jaipur, which is 7,000 bed hospital, one of the biggest in India, for infrastructure evaluation, for medical technology evaluation, and for developing future roadmap to be the best in the country. The experience of this career gave me one very simple knowledge that all of us can do many things provided we have passion and perseverance. If there is a perseverance, nothing on this earth is difficult and everybody can do everything. And it is not industry. I have worked with Big Four. I am currently a hospital planner with Government of Maharashtra, with Government of Madhya Pradesh. I got an opportunity to design a district hospital in Madhya Pradesh at Morena. When I was awarded the project, one of the architectural firm went for litigation against me, my company and government that a hospital architect or architecture firm can only do hospital designs or designs as per Council of Architecture. The then secretary asked me what can be done. I said, give them the designs which were revised by me for Government of Madhya Pradesh. Almost 57 hospital designs under construction were revised by us, for which even Government of Madhya Pradesh got accolades, and that was published in the coffee table book as replicating ideas with the heading improving hospital design to improve quality of care. Now, since there was a litigation, it went to the court, and to my surprise, the court gave a judgment, which was the landmark judgment, that now onwards, hospital design can be done by hospital planning and design firms or consultants who have architects on board. Right? Now every public hospital in the country, in their tender it is given that there has to be a hospital planner on board for designing a hospital. Because architects, though they may be good, but they cannot be master of every subject. Even a kitchen requires lots of input from a housewife. So, a hospital or an educational institute or a science lab, it requires expertise of those people to take their inputs for planning. Over a period of time, with experience and foresight, I predicted many things. Like daycare center was my first research article which was published in Economic Times. I wrote articles on eye care, various healthcare, other issues. My latest prediction is that the future business model will be geriatric care, home care, or acute care, small hospitals model. Geriatric care, comprehensive geriatric care model is the current model which I have taken up to be developed. As we understand, all of us in our families or relatives or larger families have seniors which are 70 plus and require assistance. Now, who will take care of them? Today, we are proudly saying that we are a young country, but over time, this trend will start reversing. If today we won't take care of this issue, tomorrow it is going to explode. India is not having any security system, social security system like US or Europe. Now we have decreasing birth rate and increasing life expectancy. So our population of seniors is going to grow more. We are going to need resources. As we already see our healthcare system, it is already short of resources. We spend one of the least amount of money on healthcare. Only about 3 to 4% of our GDP. Whereas other countries or European countries, they spend much more. This geriatric care model is basically again not a typical old age home, which is a stigma we don't want to really discuss. It is a home for senior citizens away from home, where in the hospital campus there is a senior citizen home and it is a hospital with hospitality, where everything related to senior citizen can be taken care of, not only medical care, but even yoga or diet counseling or physiotherapy or those kind of care can be done there. Then it is backed by home healthcare solution. When they are at home, even there now there are gadgets available that almost 70% or 80% of even medical care can be done at home. Right from routine checkup to sample collection which is happening every day at your houses, to even doing diagnostic care, even doing dental care, even eye checkups are already happening. Dialysis can be done, intensive care can also be provided at home. Physiotherapy can be provided at home. So this will be backed by a home healthcare solution, which will be done through a mobile clinic. And this mobile clinic will be supported by various portable devices which are already available. And it will be backed by a team of clinicians, nurses, technicians, physiotherapists who can go home and help this patient when they are in need of service. Again, there will be a helpline where people can call. there will be an app where patients can register or senior citizens can register. At the same time, hospital who are part of this uh, work or business model can register. It is actually a social business model backed by philanthropy. It is not, it can and should not be a business. But at the same time, it has to have sufficient revenue to sustain, because it is not easy to push in those models and then take them further. So now, as a management consultant, I am developing this model at Arihant Hospital Indore, which we have taken up for operation management, and very soon you will see this model running and taking care of senior citizens. So friends, let us come together, create innovative ideas to take care of our senior citizens and make them happy. Thank you.